Anxiety can affect many new parents during pregnancy and after childbirth, a time that's called the perinatal period. Anyone can experience anxiety symptoms during the perinatal period. Experiencing anxiety at this time may be even more common than perinatal depression. Research shows that for about 1 in 7 women and gender-diverse birthing people, anxiety symptoms cause significant distress or have a negative impact on day-to-day life. Anxiety symptoms can start before, during, or after pregnancy. There are certain anxiety disorders that can occur perinatally, such as generalized anxiety disorder and panic disorder. There are also anxiety-related disorders such as OCD and PTSD, where anxiety is a main symptom. Anxiety symptoms can also occur even if the main diagnosis is another disorder, such as depression. Experiencing worry or stress or feeling a bit overwhelmed doesn't necessarily mean you have an anxiety disorder. Sometimes anxiety in pregnancy and postpartum may increase if something stressful happens, but goes away quickly on its own. In comparison, an anxiety disorder is more severe and persistent, where the intense worrying and negative thoughts and feelings are more distressing and harder to get rid of. An anxiety disorder can have a really big impact on how people function in their day-to-day lives. The strongest risk factor is a past history of anxiety or other mental health problem, especially if it wasn't fully treated prior to the perinatal period. Other risk factors include a family history of anxiety, a lack of social support, having pregnancy or postpartum complications, and experiencing stressful life events. Anxiety can be experienced in unique ways during pregnancy and postpartum. Both during and outside of the perinatal period, symptoms of anxiety can include worry that is hard to control, restlessness or trouble relaxing, trouble with concentration, panic attacks, avoiding situations that cause anxiety. There are also many physical symptoms that may be caused by anxiety, some of which are hard to separate from symptoms of pregnancy and the early postpartum. People can have all types of anxiety symptoms, but here are some of the anxiety symptoms that can come up in pregnancy and postpartum. Symptoms of anxiety can include repeatedly seeking reassurance about your baby's safety, having trouble controlling your worries about health in pregnancy or about the health, development, or safety of your baby, having a lot of trouble with self-doubt and with controlling your worries about your ability to parent, feeling constantly overwhelmed with coping with parenthood, avoiding letting others touch or look after your baby, and excessive worrying when being apart from your baby. In pregnancy, some people may also experience fear of childbirth. This can include a fear of body changes, fear of pain, fear of dying, or fear of loss of control during labor and delivery. Anxiety can also include intrusive thoughts or obsessive worries about harm coming to your baby. Intrusive thoughts are unwanted, disturbing thoughts that you can't control or get rid of. They are very common in pregnancy and postpartum. Intrusive thoughts can include thoughts or images of harm coming to your baby or even of harming your baby on purpose. Most of the time, these thoughts are very distressing to people as they do not want to harm their baby. And having the thoughts does not mean that they will. That being said, it is important to talk to your doctor if you are having these thoughts to see what might be causing them and how to treat them. Anxiety in pregnancy and postpartum is highly treatable, including with increasing your supports through counseling or therapy, and sometimes with medications and other treatments. To learn about how to prevent and treat anxiety in the perinatal period, you can watch part 2 of this video. You can also download Seeds of Hope, which is a guide to mental health issues in the perinatal period, and access other resources related to the 2024 CAMAT guideline for perinatal mood, anxiety, and related disorders, such as information on diagnosis, symptom scales for you to fill out, and more videos in this series. Remember, you are not alone, and help is available.